Even after 15 years of being an opted-out physician, there's still a great deal of confusion about what does being an opted-out physician mean and what does that mean for patients. And certainly some of the other doctors in the area would like you to believe that opted-out physicians do not want to see patients on Medicare or other government programs. This is far from the case. I and Dr. Broome are happy to see Medicare patients. In fact, about a third of my practice are patients who are straight Medicare.
Having been in Medicare for the majority of my career, I can speak for both sides of the story here. When you accept Medicare, you have to play by their reporting rules and you have to go by their guidelines. Otherwise, they're not going to cover the visits and they're not going to pay for the care that you need as the patient. In order to do that, the only way you can succeed is to run a factory. And you guys have probably been to a place like that where you're just a number, you wait 3 hours to be seen for 5 minutes and you really don't get any communication. We do not want that model. We've been in that model, we're burnt out, we don't like that. Our goal for being in medicine is to develop relationships with people and make a difference in their lives through surgery and through non-surgical things too. By opting out of Medicare, that's freed up our hands from the guidelines that are placed on us and allowed us to focus on you, the patient, and providing the utmost quality of care.
And Medicare, though, will pay for any lab service that is not directly to the physician. So if an opted-out physician brings a patient to the hospital, Medicare does pay the hospital. They do pay for the x-rays, they pay for the laboratory, they pay for the anesthesiologist. If there's an implant, they pay for the implant. Cover everything except the doctor. Now, between the opted-out physician and the patient, it becomes a fee-for-service basis. The approach that Dr. Broome and I take is we try to make our fees affordable so that most people can afford what we do.